are talking sunscreen myths ahead of the holiday weekend. An expert is joining us to share some of the best ways to enjoy the summer. And joining us this morning is Dr. Wendy Sadoff, a dermatologist from Farmington Hills. Good morning. Thanks for joining us.
Good morning. Thank you.
Well, it's inevitable. We're going to be out enjoying the sun, some of us more than others. Is there any good way to actually lay out and tan?
There's really no way that we can say a tan is healthy. It's actually the skin's way of compensating for and protecting your skin against those rays to kind of build a barrier, a pigment barrier from the harmful radiation. So no healthy tan, but if you are using sunscreen appropriately and in the amount recommended in covering all areas and you get a little color, it's a lot safer than if you didn't follow those recommendations, that's for sure. And some people will get color. They're just out a lot.
Yeah, so we'll probably be out a lot this weekend with the forecast. So when we are looking to purchase sunscreen, what's your advice in terms of finding the one that gives us the best protection?
That's a great question, because I feel like we've inundated our patients with wear sunscreen, and yet there are so many products out there, and there's a lot of misinformation, and a lot of people kind of aren't really clear what they're looking for in terms of SPF, and they kind of view the SPF as a global indicator of how well that product is going to perform overall, but it's really just a measure of ultraviolet B protection. So I say that's a start. Certainly don't go below 30, but turn the package around and look at the ingredients, and I always say think zinc. Zinc is going to be a physical block. I call it like invisible clothing, and it's going to really be the best block for that ultraviolet A wavelength.
So you said at least an SPF 30 and make sure it has UVB protection, and then look for zinc on the label. I just want to make sure I got it right.
Okay, so SPF 30 first thing. Look for broad spectrum so that you're getting some ultraviolet A protection as well. And to get your best ultraviolet A protection, turn it around, think zinc, look for zinc.
Now, this may be a dumb question, but everyone says there's no dumb questions. If someone takes zinc supplements, is that somehow protecting you from the sun, or it really has to be something you're applying to your skin?
It has to be applied. It's a great question, though, because there are a few things that we can take orally that can help. There's a product called Fern Block, and that can help. We really don't want to push those too much because people tend to think then they don't need sunscreen. And your first defense is really sunscreen, after finding shade, of course.
All right. So in terms of inspecting our skin and our children's skin, what are some things that we should be looking for that means we need to come and see you in your dermatology office because there could be some potential problem?
I think if you have moles, which everyone does, I think you at least need a baseline skin exam. And I think the earlier the better, because when we see kids, we can start talking to them about, putting on sunscreen and putting on a hat and really having these behaviors be second nature to them and actually not be something that their parents demand of them, but kind of make it fun. And there are some ways to do that. So I think, as soon as kids have moles, they should come in at least for a baseline exam. And the baseline exam is so important because most of the time I look back and I have diagnosed a worrisome lesion. It hasn't been the lesion that the patient has come in for. So sometimes, unfortunately, they're not as alarming to look at as a lay person. And so just coming in for something, just coming in for us to take a look is really important.
And of course, your doctor's eye would notice that a mole is abnormal more so than any of us, but is there something specific that we should be looking out for, like an identifier of what mole might be a problem?
So I say something that looks different from the rest of yours. So in the past, we talked a lot about looking for these wild, irregular, asymmetric moles. But if you're going to wait for something to look that wild, you may be waiting too long. So what I say is look at your moles, kind of get to know what most of your moles look like, what color brown they are, about what size range they are. And if one is sticking out from the others as being different, behaving differently, that's what we want. What looks different, what's changing, and what just gives you an unsettled feeling? Because sometimes there's just something about it and you can't really say what's changing about it, but you just don't like it. You don't think it was there before. So new, changing, or different from the rest.
And ignoring that, what are the consequences?
Well, of course, when something is more advanced, you're in a whole different treatment regimen. I mean, if we catch something early, we can give someone a 99% cure rate with a very minimal procedure in the office. and it's a much different situation if someone prolongs the time till they're diagnosed. So sometimes people are afraid to come in, but it's always better to come in.
Well, Dr. Sadoff, thank you so much. That is some great information. And I think I should just add, not just checking your own moles, but have someone else check you because there's certain areas that you can't see. Great information. Thank you.
Thank you very much.